person who wants to have a child, even before they get married, ideally, if they can, actually discuss this with their partner, what are their parenting preferences, not as a very detailed discussion, but at least that conversation should start. There are a lot of maternal stress factors, alcoholism, substance abuse, all these things affect the child's brain development. So any child is a combination of genetic and epigenetic factors. Every generation feels that the next generation is doing something less and not good enough. My grandmother, used to tell me that for every month in the first year of the child's life, birthday was celebrated with one specific type of mithai. So an empanadas in English. So it's a folding moon circle, yes, right? A traditional way of teaching the mother that your child should be able to do this now. If this was not happening, then there's a challenge.
Our guest today is Dr. Swati Vinchurkar, founder of Surat's first multidisciplinary child development center, Sadbhav. She built Sadbhav with one purpose. She would love to help families to have a single safe place for the early intervention of their child instead of moving from one specialist to other. It's the Urja Development Center which you are building, which is a foundation, or there's also a name called Sadbhav.
Yes.
Development Center.
So we kind of start from the very beginning. So Urja Child Development Center was our baby, which we started in 2007, with the idea that all the children who needed some form of developmental intervention or therapy services should get it at one place. And of course, it should be more accessible to them because of that, availability in one place. But it was a privately funded unit, and over the years, so we started with 3 therapists, including myself, and 2 kids.
Okay.
And now it has grown over the years since 2007 to almost like 25 therapists in the team.
Okay.
So yes, we are now proudly, the biggest multidisciplinary team in all of South Gujarat, maybe even in Gujarat, I don't know. But that is something which we realized along the way, that most of the developmental interventions, whether it is for autism, whether it is for ADHD or learning disabilities, or for cerebral palsies, they all are very long term.
Yeah.
So for a family who comes in for a diagnosis, come in with the hope of a cure which is instant, or like as quick as treating malaria or a fever, but then they are not pleasantly like they get into that phase where they have to accept a long term plan, long term therapies, which means a lot of expense over the years. And that affordability was becoming a big challenge. So there would be dropouts. We know that a child who needs intervention would be spending like 100 to 300 rupees just for traveling, and then the therapy services also would not obviously be completely free, because the therapists need to be earning their own remuneration. So that's when we came up with this idea of converting the child development center into a foundation. So the foundation is effectively the same set of services with a bigger setup or bigger team, but the foundation is a not-for-profit registered company. With this, we could engage a lot of philanthropists from the society, or people who are willing to help others, and we give them a trustworthy way of doing it. So a child who needs therapy but the parents can't afford therapy, we pair them with somebody who has the money, who has the willingness to donate or sponsor a therapy service, and we pair them together. So this way the child is getting the intervention, the therapists are also getting paid their dues, and somebody who is willing to contribute to the society is able to give back in such a way. So this was the idea behind converting Ujat CDC into Sadbhav Child Development Foundation. So I would say it is like 18 years since we founded Urja CDC. So this is the adult version of Urja CDC, and that's now Sadbhav.
Okay,
Yes.
okay. So what kind of therapies are there in this child development center?
So we have all the basic possible needed evidence-based therapies. So we have occupational therapists in the team, sensory integration therapies, physical therapies for the ones who need, posture correction, or who have cerebral palsy and need strength training, muscle training for them, breathing exercises. So the physical therapy takes care of those areas. And then there is the remedial team, which works on the learning problems. Then there is a speech therapist who works on the speech and language skills of the child. There is a behavior therapy team. So behavior therapy is needed in two different ways. So for the autistic children, we have the ABA therapy module or the autism intervention module, where we are working on their behaviors and using them as communication. And then there is cognitive behavior therapy for children who need emotional regulation or behavior modification, the older ones. And there are also, we have an arts based therapist in the team. We have a clinical psychologist who is one of the founder members, Bhavna Raja. So she's on the team, and she has other psychologists working with her. So from assessment, where we are identifying any possible red flags, right up to, a detailed family counseling session, all the services needed would be included there.
Okay.
So that's how the structure works.
Wow. Okay. Okay. And I would like to know about autism, but before that, what do you think? Like, right now, the way you are seeing that the stress is increasing and
Yes.
there are a lot of mental health issues which are
Yes.
rising.
Yes.
This particular therapy or the development of the child, any normal child whose behavior, there is no instinct of parents are finding there is
True.
any abnormality in the behavior,
Right.
but still, is it a kind of must which is needed for the society to have these kind of therapies? Like,
So, see, the therapeutic intervention will be required for very specific conditions. So,
okay,
it is usually for the children who have definitely got some developmental delays or developmental deviations or disorders. But before we go into the therapy, there are quite a few children who come to us with some minor behavioral issues or certain lack of emotional regulation. So they have frequent tantrums where the parents are not able to manage. So it is more of a parenting or a grandparenting issue, where developmentally the child is normal, but still some intervention in the form of counseling or behavior modification services may be required. Even before that, supporting normal childhood development is a very huge part of any pediatrician's practice. And we all, I think we are all trained to do that. That the history that a pediatrician takes is the most detailed. So you would go into the depth of the family, the child's diet, the sleep patterns, the, breastfed or not, bottle fed or not, and academic, the skills the child has developed. So the history taking is our, basis. From there, if the child is showing normal developmental pathways, then we just need to teach the parents to stimulate the child correctly, and support the child's normal development, identifying the child's strengths, identifying his challenges, and then using the strengths to work on the challenges, supporting the child's development that way. Then we come to the deviations, disabilities, diseases, or disorders. If there is anything going wrong at any point of time, that gets managed accordingly. So, a treatment plan for a disease would be a short term treatment plan. A therapy intervention plan
is
would
a
be
very
kind of a
long.
long term rehabilitative treatment plan.
Okay.
So, that is how the whole spectrum goes.
Okay, okay, okay. And how the, like, when it comes to normal schools and colleges, I was never aware that, this is particular therapy which is needed, or
Yes.
maybe my parents, most of the parents, they don't even realize that there's something wrong
Wrong. Yes.
until something big happens in the
Correct.
family, or very obvious when they see that,
Yes.
this is something really not normal. So, what steps a parent can take in terms of even before giving birth to the child. I
Yes.
mean, I see in the education right now, everything is taught like, arts, crafts, sports, education,
True.
XYZ. But still, there are behavioral issues.
Yes.
And it might come even before the birth, as in, because when the child is in the womb since
Absolutely.
then.
Yes.
So, what should be the way out so that people can have a better life in this case?
Wow, that's a big question. But I'll try to answer this the best possible that I understand is that any child is a combination of genetic and epigenetic factors. So, genetic meaning whatever is the hereditary DNA material that the child has received from the parents.
Mhm.
And then there are epigenetic factors, meaning the way our diet patterns have changed. We are eating less at home and
Nutrition,
more from
yeah,
outside.
yeah.
There are instant preparations available which are affecting the child's brain development. Then there are a lot of maternal stress factors, alcoholism, substance abuse is higher in the parents in this generation. And the grandparenting patterns have also changed. Our screen times have increased, so our socializing, the parents socializing has gone down. And all these things affect the child's brain development. So what I eat today as a parent would affect my child maybe 10 years down the line. So everybody needs to consciously be first working on their physical health for sure. So all the lifestyle diseases, the factors which are affecting the lifestyle diseases obviously affect the child's life later on. So that needs to change. Also, in our schooling system or in the way we nurture our children, there is very little focus on teaching each child the vocabulary for mental health.
Yeah.
It is a very, a cultural thing that we ask Kemcho and we reply Majama, but there is no meaning to that answer,
Yeah.
right? When you said that, you yourselves have been a victim of, mental health issues earlier, I would say you are a survivor.
Yeah.
The fact that you have now become aware and now you are working towards taking care of yourselves better, we need to teach children how to express their true emotions, how to actually express what they mean to say, and that the parents also need to learn to do that. So very often when a child asks for a chocolate, this is a very simple example but a very common one, that a child asks for a chocolate and mom actually wants to say no. Instead of saying no, she'll say that you just had it yesterday, or she'll say, okay, I'll give it to you after a few hours or later. And the whole conversation just keeps on dragging without coming to the point that no, you can't have a chocolate right now, right? So, age appropriately, a child should be able to hear a no and also parallelly develop other life skills of resilience, empathy, as early as 1.5, 3 years of age. At that level, you're not giving them funda. You need to give them behaviors which are desirable or undesirable and be able to express their feelings. So, something very basic as I'm feeling sleepy or I'm tired or that I want to go potty, the kid will not be able to express it if they have not been taught that. They'll show behaviors. So a child who wants to is very happy may just jump up and down and flap hands instead of saying wow, I'm very happy. And the same child, if he wants to go potty, also will be doing the same behavior because he has not learned the vocabulary to express himself. So these are some very fundamental missing areas which a parent should be working on in the early childhood. So early childhood means 0 to 3 years or the first 1,000 days, what we call, because those are the formative years for each of the developmental areas. So our development peaks at 3 to 6 years.
Okay.
So all the good or the bad happens in the first 3 years. And if we don't identify or work on it at that time, it's sometimes too late to really.
And it comes later, right? It triggers
It'll
maybe when it.
manifest much later,
Yeah.
but yes, so all those things need to be addressed as early as this.
Okay. So consider, like, tomorrow if I'm conceiving, or maybe in the future, and there is during my own pregnancy, I think you have a collaboration with the Pregnancy 101 or
Yes, yes.
yeah.
So A to Z and Pregnancy 101 both.
What is that?
So these are antenatal classes. Earlier it was conducted by two beautiful ladies, Tushita and Neha, and now I think Tushita handles the pregnancy A to Z sessions. So we have been doing antenatal lactation management counseling with the group of mothers who come there, because we realize that that is the time when they really are eager to learn how best to work with their children. So that is where we ideally would start. So like you rightly said, a person who wants to have a child, even before they get married, ideally if they can, actually discuss this with their partner, what are their parenting preferences, not as a very detailed discussion, but at least that conversation should start. And when you get married, planning a child should happen at the right time, not because people need you to
Have a
get
child.
pregnant, or because maybe you are fighting too much and your family says that bachcha ho jayega to problem solve ho jayega. It should never be the reason to have a baby, right? So planning a child should be because you want to have a child and you want to nurture that child. It should not be for show, because quite often once the baby is born and your whole schedule changes and you start losing a lot of sleep, you can't go out for late night parties often, and that's when it hits you, array, that I am not prepared for this.
Hmm.
So being mentally okay with that change also is a part of preparing yourselves as a parent.
Mm-hmm.
When you wholeheartedly get into that thinking that this is exactly how I want it, you will still make mistakes. It's fine,
Mm-hmm.
right? Parenting is not an exact science, but the whole, the feeling of wanting to be the right parent must be pervasive. That cannot be negotiable.
Okay.
If you want a baby, then you should be ready to take care of the baby.
Responsibility and
Yes.
everything,
If
mentally
you have to
prepared.
give up a little bit of sleep sometimes, that should be perfectly okay. It should not be a mental stressor कि अरे मेरी तो अब life ही बदल गई and I'm not able to take care of this child anymore. There is no return policy on a baby, right?
Yeah.
So that is very important. So
So during this pregnancy time also, the amount of stress the woman takes, even that affects on the
yes.
brain of the child during
So
the
there have been
development.
multiple studies, especially in case of autism spectrum, which has identified that if the mother is antenatally depressed or is facing a lot of mental health issues, or immediate postpartum depression is significant, then because the mom's socializing goes down, possibly that is the reason that the child also starts to develop those
Symptoms,
social
yeah.
communication issues. And then the wiring of the brain also gets affected, because the stress is going to change the chemicals in the child's developing brain. So those do contribute to the way the child then develops.
Okay.
So yes, maternal stress is a very big risk factor for any mental health issue, I would say. So, and I think it has directly also to go with the fact that what does the child see happening in front of him. If the mother is stressed, is the mother is not able to communicate her emotions very easily, or is genuinely, facing some mental health issues. All that is something which the child senses by body language.
Okay.
So that also gets reflected in the child's development
And
eventually.
this is when the child is in the womb, you're saying, or when
Beginning from there, yes,
beginning from
beginning
there.
from there. And nowadays we are seeing more of IVF pregnancies.
Yeah.
So IVF pregnancy is something that you are getting into a pregnancy already stressed up because you want the IVF to succeed. You quite often have
Yeah.
twins or triplets. So that also is an additional challenge. It is financially a big, burden. I wouldn't say burden because
It
you
is for
want it,
money.
but definitely it is
It is a strain.
money
Yeah,
intensive.
yeah,
So all those things, and if you end up having twins or triplets, everything is going to double up or
yeah.
triple up, right? So the school fees are going to increase. So all those are a
The
big
stress
stressor for both parents that way.
and this
And if
affects
they are
them.
not a strong team to start with, then that becomes a challenge for the child for sure. So
Okay, okay. So when it comes to the parent development also, as in the training for the parents, that's what Pregnancy 101 or
yes,
is
so
doing,
that
like
is the,
the
I think a lot of obstetricians do that. So,
Garv Sanstha
whether you
or
call it
something.
Garbh Sanskar or antenatal classes, the idea is that that is a common space where everybody with common concerns or doubts can sit together, talk about it. You actually have a support group around you to be able to share your concerns. The word of caution is that the support group should remain a support group. It should not actually become a comparison group, that because this person had a baby of this much weight, I also should have a baby of this much weight, or else I am not good enough. That comparison can trigger a challenge, but otherwise I think most obstetricians nowadays do have these support groups or antenatal classes or GURPS sanskar, whatever name you call it. The idea is to take care of your mental health during and throughout
The
pregnancy
pregnancy and
and
after.
postnatally also,
Yeah,
because the
exactly.
first 3 years post delivery will be the most crucial. So the 9 months and 7 days of the pregnancy and the next 3 years are the most crucial, you know days or hours of the child's life.
Oh
So
my God. And if those are not taken care of properly, then what might happen, like worst cases and
multiple issues, right? So any child's physical health would directly be affected if it's a high risk pregnancy. Uh, we have wonderful NICUs these days that we are being able to save as babies as small as 700, 600 grams. Just the day before I was in Jagadia, and that is a level 2 unit. So
hmm.
it's still not a level 3 tertiary referral unit. They are also saving babies as small as 700 grams. So obviously, those babies who are born at like 7 months, 8 months of gestation, their brain development, which could have happened best inside the womb, have missed out on that part.
Mm-hmm.
So obviously, these babies are called high risk newborns.
Oh,
So if
okay.
they've had, they've not cried at birth, or they've had a preterm delivery, or they needed ventilation, or if they had seizures immediately after birth, or if they had very heavy jaundice immediately after birth, all these are considered high risk pregnancies. So these children will need a closer monitoring for their development, and these children are the ones who, if we can pick up early, we can also make a difference in the uh,
Hmm. Hmm.
outcome of the
Hmm.
child.
Okay.
So yes, that is where I think developmental pediatrics initially started, from identifying high risk newborns and monitoring them or treating them. And now we have come to the conclusion that a life cycle approach is needed.
Yeah.
So a child needs to get the best support for his development. That child, when he grows up into an adolescent, also needs to be managed the best for that age group concerns. So adolescent health is itself a huge topic to work on. And then subsequently, when they plan to get married, pre-marital counseling followed by pre pregnancy counseling, prenatal counseling, if you call it. And so at each step, these interventions would help ensure that any child who is born into the world should at least have had the best chance. I'm
Yeah.
not saying we can prevent all developmental delays or disabilities or diseases, but at least we can minimize the effect of
Okay.
it. Yeah.
Okay. Wow. Got it. So, For me, what I feel is that even during in this particular generation or era we are in, where
Right.
the mental health issues are, there's no escape
Correct.
to it. Any normal person also has stress overloaded
True.
because of the way the date. It's like energy everywhere is of stress,
True.
so you cannot escape from it. So even the normal delivery or when it comes to IVF, it is a very different
Yes.
thing that so I feel should go through that because stress is already there.
Yes.
But even the normal delivery, they should have some, like, they should be coming to a center like Sadbhav for the Child Development Center from the time the baby starts growling, or when the it
So
is even in the 1 month.
wow, that is something would be, a very ideal situation, that a newborn uh, who, is not at risk of any major issues at birth, but still at around 1.5 month, when the child has the
A
first
little bit, yeah,
vaccine post
yeah,
BCG. So that would be a great time frame where we are talking to the parents about postnatal development that they should monitor in the child. And if they have any concerns, how can they monitor themselves at home? What can be, some basic stimulation activities for the hearing, for the vision. Ideally every newborn should be screened for hearing. Okay,
hmm,
because even if it is like the chances of one child developing or having hearing loss in 1,000 children born, but for that child it is 100% problem, and quite often that gets missed out, the
yeah,
hearing loss. So all these basic medical screening should happen within the first 3 months post delivery.
yeah,
So if there is this kind of group where parents of more or less between 1 and 3 month old children are coming together, and this can be communicated to them in a group, then they can take care of each other also. And small things like talking with the baby while feeding the baby, or singing to the child, rocking the child, which is now getting transferred to cradles, and they have these fancy pods which they take to carry the baby nowadays. What better hands than the hand of the
yeah,
parent?
yeah.
You don't need a fancy pod to carry the baby,
And
you
this is
don't need a
also,
rocker,
yeah,
or you don't need any fancy gadget to hold your own baby. You don't need a timer or an alarm to tell you that it's time to feed your baby now. The baby is your best alarm. You don't need a breast pump to express milk. The baby will get milk as the baby wants it. Intervene lesser and lesser, let nature take its own course, and be very relaxed about it. So that is something I would love, that if parents come together in a group at the same age, uh, and we take them through that journey, in the first 3 years. That would be wonderful.
but is it happening now?
It happens in small
Very
groups
rarely.
and patches, but it's usually when the parent comes up that I need guidance for this.
It is
So
not like a mandatory, yeah, I am pregnant now, let me go through this because this is very
I
good for
I
that
wish.
education or knowledge or
So
awareness is
yes,
not there yet.
it is given out in bits and patches. So yes, there would be pamphlets that the parent might be reading, or they would be googling sometimes. But I would wish that they would trust Google less for these things at least, and they would
Oh,
actually,
this is a common thing which I
yeah.
hear. Like, even if right now I'm having herbal life morning. So my parents, हम लोगों को ये सब की कभी जरूरत नहीं पड़ी,
जरूरत
पता नहीं
है.
तुम लोग कुछ नया नया लेकर आ जाते हो,
Correct,
क्या करते हो क्या?
correct.
I'm like, अभी का खाना देखा है, as in they are like
हाँ,
for anything, as in all this is not needed.
correct.
We also है ना had babies,
Yes.
we also हमने भी पाला है, कुछ तो हुआ नहीं है, सब तो नॉर्मल है करके तुम लोगों को कुछ नया नया फैंसी चीजें लेके आनी. This is
True.
what, and this is there in almost, I
Every
guess, very,
generation.
yeah.
So every generation feels that the next generation is doing something less and not good enough, right? And vice versa, that the next generation feels that the older generation had different challenges, but our challenges are real and different. So I would not always be very black and white about it, that there was a lot of wisdom in some of the practices around babies that happened in those times. So for example, my grandmother, used to tell me that for every month in the first year of the child's life, the first every month's birthday was celebrated with one specific type of mithai,
Okay.
and that correlated with the child's developmental milestones. So karanji in Marathi, ghugra Gujarati mein. So and empanadas in English. So it's a folding half
I
moon
know.
circle,
Yes.
right? So whenever a child is ready to turn over, that's around 5 months of age, and that's when they used to make the ghugras.
Okay.
This was a traditional way of
Ancient.
teaching the mother that your child should be able to do this now. If this was not happening, then there's
there
a
is
challenge.
problem.
So there was a lot of wisdom there, but now it has
Modern.
shifted to rituals, and there is no science behind it.
Yeah.
So it would be great to go back to those times with all the scientific concept of it, and still implement the good parts of it. So ritually they used to say that a mom and the baby should be isolated for 42 days, and it is needed. That is exactly apne yahan abhi a baby is born by cesarean delivery. Even before the mother can see the baby, there are 10 relatives who have picked up the baby in their hands.
Yeah.
And that is so infection prone. Everybody coming and handling the baby even before the baby has had the first breastfeed. So all these practices are definitely not safe for the baby. So that wisdom,
Even psychologically, I would say.
yes, the baby needs to bond with the mother first before he's suddenly thrown into the big bad world, right? So those things were definitely scientific, but they have kind of got lost along the way.
Okay.
So we need to go back to those basics a little bit. Postnatally, if the mother is advised to have those ghee wale laddu and halwa, again those are looked at by most diet conscious people as itna tel itna ghee nahi khana chahiye, but that ghee is needed for the child's brain development.
Okay.
The calcium and the iron rich foods that are prepared traditionally are good for the mom's health, her back, her bone health, her uterus lining to come back to normalcy, or making good milk for the baby. All those were practices which had science to it. That does need to come back. We just lost it along the way.
Yeah.
So I would say that instead of trusting the breast pump to make more milk, the mom should actually just relax with the baby, put the baby to breast more often, and the baby would
More
actually
natural
develop
things,
more
yeah.
naturally.
Yeah.
That way.
Yeah. Got it.
So, two things which a breastfeeding mother should never do is bottle feeding the baby and using screen time while feeding the baby.
Oh,
These are
yes.
two very big problems, I would say.
Screen time. Screen time, though, it scares me.
Yes.
Recently, I went to my friend's place whose wedding is there, and there were like 4 kids over there, okay? All 4 in the same room, everyone with a different cell phone,
Absolutely.
not talking with each other at all. They are just completely like till here, they are using the
Yes.
cell phone and goes. How it is going to affect them psychologically in future, or maybe right now?
No,
as
it
well?
has started showing the ill effects, I would say. So, just yesterday, I had a child. When you came in actually to
Yeah.
the office, there was this 3.5-year-old who they stay in a remote area in Dediapada, and the parent had not brought, the Masi had brought the child, because every time that the child is not given the phone, the child starts to scream and cry, and can continue to cry for like hour or 2 hours, and stops only when the phone is in the hand. And effective screen time through the 24 hours is like 10 to 12 hours every day. Now, this must be a lot, yes, agreed. But in the age group up to 3 years, even 1 hour of screen time is too much for the baby's brain development, because it is hijacking the child's senses. So, a child commonly gets the phone when the child starts to eat.
Yeah.
So
Yeah.
around nine
Majorly
ten
during
months,
lunch.
when they have become a little mobile, बिठा के रखते हैं and they put the screen in front
Yeah.
of them, and then the child is, like a fed. The point is the child doesn't look at the food. The child doesn't see the food, smell the food, touch the food, taste the food. The food is just getting swallowed inside. So that's where the first problem starts. The child does not learn to eat by itself. Is often overfed क्योंकि moms want थोड़ा और खा ले, थोड़ा मोटा दिखे बच्चा. So that becomes a challenge. Along with that, every time that not just the child's but everybody else's screen is also on. So screen could be like your mobile, laptop,
Laptop, anything.
ipad,
Yeah.
TV, everything. And I'm sure every household has at least 3 of these gadgets
Yeah.
in a family of 2 people
Yeah.
right now. Right. So the screen time is so high, and because of that the people are not talking with each other as much. So the child's attention span has started to go down. We are seeing a lot more children with attention deficit, not just children, even adults.
Yeah.
Like, I don't remember that I needed a screen to keep me busy when I was, say, 18, 19, 25. I could easily finish a storybook or a big novel in 3 days time, right, in along with my work. Now give me a page to read, and like at the end of 2 paragraphs I'm like, where is my attention span? It is that bad. So for a child, they're beginning with this, and then they cannot develop good attention span. The chemical changes, the dopamine levels which go high when they're playing video games or watching very exciting rhymes, or those flashy lights and colorful rhymes on the screen, the dopamine levels hit a high, and then they keep needing more and more levels of
Of that.
dopamine to maintain attention. So that's why children can look at the screen for hours, but you give them some other activity and their attention span goes down. The other, I would say, epidemic, pandemic, or the challenge that we are facing is more and more children showing signs of autism spectrum disorder.
Yeah. I wanted to know
So
about this.
a
What is
child,
this? First, what is autism?
yes, so
This is the first time I heard from you. Can
right.
you imagine? And then I got to know there's this guy, there's this founder, Elon Musk, if you know him,
Yes,
uh, Tesla,
Tesla.
and all. He is an autistic child.
So
That's all I
yes,
know.
so it is, what do you say? It earlier was considered deaf mutism. Okay, deaf mutism meaning a child who does not listen or speak very well. Okay,
Okay.
but that should remain a term for children who actually are hearing impaired or who are not able to speak, have aphasia. Autism is actually a neurodevelopmental disorder which, uh, wherein the child is not able to communicate socially. Speech may be there. So a child may be saying A to Z or singing rhymes, but he cannot say mama or papa. He does not understand social relationships, or for his needs he would take the parent to the object. So if he wants milk, he will put the glass in front of him or take the person to the fridge, but will not be able to say milk, doesn't make very good eye contact. If you call the child by name, the child may or may not respond. Most of the times the child would not respond. So the child is connected more with objects and less with people.
Okay.
Right. And the second part is that even if he is connected with objects, he doesn't have the necessary play skills age appropriately. The child classically by 20-22 months would start showing pretend play, like phone पे बात करने की एक्टिंग कर रहे हैं या खाना बनाने की एक्टिंग कर रहे हैं. They would serve up a tea party, whereas
Yeah.
these children have very few imitation skills, or if they imitate, it will be randomly at some time. So if I say pani chahiye, and instead of saying ha, the child would say pani chahiye in the same tone that I said it. That's called
Okay.
echolalia. So a child on the autism spectrum can be verbal or not verbal. The child can have a range of intelligence from being intellectually disabled to being very intelligent or gifted in certain areas.
Wow.
So, world over, there is a very famous lady called Temple Grandin,
Huh.
and she has a PhD to her name, and she was the one who highlighted the fact that children who are on the autism spectrum can learn, and they can achieve even such high academic levels, but they need the right environment for that, or to first identify what their strengths and challenges are.
Okay.
And because they have repetitive patterns, their behaviors seem very odd. So they would keep looking at, suppose it's this light, and they would just start looking, or trying to touch the center of the screen, or looking at the spinning fan, or keep looking outside at the shadows. So something like you would have seen Priyanka Chopra's character in Barfi,
Yeah.
or the way she speaks in a very staccato
Huh.
manner. There is no intonation in the way she would speak. Or My Name is Khan, where Shah Rukh Khan was
Yeah.
an autistic individual. So it is something with the way the brain is programmed in the social communication area, in their emotional framework, that they understand these aspects differently than us. Okay. And now we have moved away from calling them mentally challenged. Earlier, even their certification was in the mentally challenged category. It is not a mental impairment, it is just a different type of person who has developed differently. And yes, there are a lot of risk factors which can increase the signs or symptoms of autism spectrum, like excessive screen time or heavy metal toxicities, but there is no exact known cause for it.
Okay.
Right. So, like, if we take Down syndrome or trisomy 21, we have an exact chromosome which is attributed to this condition, that is Down syndrome. We don't have any such diagnosis, whether it is genetic or biological, for autism spectrum.
Okay.
And it is a whole spectrum. So a child who is not verbal, who is mentally challenged or intellectually disabled, or a child who has some very savant skills, is called an asperger's, but all of them still come under the umbrella of autism spectrum disorder.
Okay. And how we get to know as a parent
Hmm.
that the child has is like this or has certain symptoms like this,
so
which might
that
be
so
autism.
that's where the developmental surveillance or monitoring is useful. So a child, technically should never be labeled as being on the autism spectrum before the age of 3 years,
Okay.
but all the risk factors starting as early as 7 to 8 months. So as a pediatrician, I would probably be even earlier to pick that up, that this child is not having a social smile at 2 months, or is not making very good eye contact when the mother is dressing the baby or changing the diaper, or is a very fussy feeder on the breast. So those could be some early markers. I'm not saying that these are exact signs, but these could be some early markers that the child is socially withdrawn.
Mm-hmm.
Okay. By the time the child is 7 to 9 months, the child should be able to respond to the child's name. So when I call out to the child, or the mom calls out to the child will try to localize the sound, turn towards the sound, look at the mother, smile, playfully, interact, coo, gurgle. That might not be present. By the time the child is 9 to 18 months is when we can start to pick up a lot of these some signs.
Okay.
So pointing is missing. Most children by 9 to 12 months can isolate their index finger, point. You will often see them poking their finger in the electric
Ha
plugs,
ha ha ha.
right? So pointing is something that they miss out. There is something called as joint attention. So if I am showing the child, look, there's an aeroplane, or show me the light, where is Papa? And the child does not respond to that, right? So the child is not able to connect with these social skills at the age appropriate level. By the age of 3 years, most of the diagnosis would be very, very clear, that there is very limited eye contact, The child does not understand the social environment. Where am I? Will have a lot of sensory problems, that they would be fussy in eating, they might be hyperactive, or they might put things in the mouth which are not edible. They have some certain particular repetitive patterns, like walking on their toes or flapping their hands. And obviously, because our then school system is not geared to take care of their learning methods, then they would have learning challenges also. So they often have certain behaviors which can seem dangerous to other children, where they push the other child or go and hug anyone in their proximity, but not realizing their personal safety also sometimes. I had one parent come in and tell me, that कल मैं मेरे बच्चे को पार्क में लेके गई थी, जैसे आपने बोला था कि उसको लेके जाओ, एंड वो हैंड फ्लैपिंग कर रहा था, तो दूसरे पेरेंट ने बोला उसके बच्चे को कि इसके साथ मत खेलो, ये तो पागल है. So, for a layperson or society at large, these behaviors seem odd, or they call them mental, or pagal, whereas they are just different. If you see a child doing this in a restaurant or in the park, you can, as a society, be the biggest support by just being okay with it. First of all, you have to ensure safety. I'm not saying that you let the child do anything or everything, but just be okay with that, because the parent is struggling with a lot more challenges. Right, so autism spectrum kind of encompasses all of these things. So the diagnosis, we would not ideally label the child before 3 years of age, but we can identify it much early and start by simple things. Call out to the child more often, play peekaboo with the child more often, read bedtime stories, play some games where you're throwing and catching a ball together. Once you play more, you will notice if there is something different about your child. If you already have another child, you would be able to compare their milestones also much better. But that is what is missing quite often. A parent rarely plays with their children these days. Either, COVID was an excellent example of how we could have actually made a big difference in parenting, because we had some more time to be at home with the children. But then everybody was on their screens most of the times. Either they were working from home, or they were doing the household chores. Involve the children in household chores, right? Kapde machine mein dalne hain, teach the child, this is your shirt, this is papa's shirt, this is my shirt. Small skills which actually will not prevent, I would say, but at least minimize the effect of this social challenge. So that is where, like the autism incidence, when I was doing residency, that was almost 30 years ago, I would have seen two children with this diagnosis, okay, and that is a span of 10 years of training. And now, after 30 years, I'm seeing two new children every day. So the incidence earlier, which was put at 1 in some 188 or 200 children, now is 1 in 40 children.
Okay.
In the US, that is the number. In India, we still don't have very clear
Because
statistics,
people
but
don't
this
have
is,
awareness, or I guess, or
no, we
denial will
do
also be
have,
there, no?
yes, we do have more awareness these days. So we are able to pick up children early, but still the incidence has gone up to this level. So imagine any classroom at first standard level, which has 40 to 60 children, is likely to have one child who is on the autism spectrum, mild or moderate.
My
We are
God.
not geared up for that.
How to recognize, as in, see, these are the signs, but I these are the signs, but isn't it often overlooked in a way that no, 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 मेरा बच्चा ठीक हो जाएगा, ऐसा कुछ नहीं है. Now consider, we as humans also, I might be going through this, like, the version of me right now, after so much of learning and trying and
Right.
understanding about my mind, body, and breath and everything, is so different than before hitting depression. There was a version of me
Correct.
who was going through anxiety, might be having mild depression, who never
But
accepted,
ignored it,
admitted,
or
I am all
didn't
right,
know.
nothing, all
Yes.
this is bullshit, I am
Correct.
all right. until there was a time where I had to go through medication.
Correct.
Now this can come in terms of parents ignoring it. No, no,
True.
no, my child is normal.
True.
Nothing is happening, which will result in after years, maybe 5 years or
True.
6 years, the things have gone worse.
Yes.
And I mean, how to build that?
So I think let's start with understanding how society can first help the parent pick up these things or accept these things much early. See, a parent will be in denial because the parent is afraid of what the society thinks or
Yeah.
sees their child as, right? So if the society generally becomes more receptive, more accepting for developmental challenges, not just when they watch a movie like Sitare Zameen Par, but actually on an everyday basis. If I see a child with challenges, and instead of trying to point fingers or label the child, if I'm just there for that parent as a supporting person, that will help the parent first accept the problem. See, every parent instinctively would know that there is something different about their child if they
Okay.
are at least averagely alert about their child.
Hmm.
But again, because this there is a lot of stigma in the society, the grandparents will try to pacify, or everybody around will try to kind of tell the parent that नहीं ये तो उसके पापा भी देर से बोले थे, या बड़ा होगा तो सीख जाएगा, वो तो बदमाशी कर रहा है, मूडी है, चंचल है. But that is also okay. As a developmental pediatrician, I still would not want to label a child first. The idea is that the child, if is showing some difference or is developing differently, don't just wait and watch. Start identifying what the challenge is. Start working on correcting it. You don't have to take the child to therapy also. You can do that at home. Just adequately stimulate the child at home. And that is something that we can guide them for. The parent can stimulate the child at home and they would start showing difference. So something simple as screen time बंद करने को बोलते हैं ना, so the parent is नहीं तो मैम तो वो तो फिर खाएगा ही नहीं खाना. And it is very difficult to convince the parent that बच्चा स्क्रीन के लिए नहीं खाना खाता है.
They will be more afraid मैं
बच्चे
करूँगी क्या?
करेक्ट,
बच्चा खाएगा
बच्चा
नहीं तो।
भूख के लिए खाना खाता है और बच्चा स्क्रीन की वजह से बैठता है. द पेरेंट इज पेयरिंग दोज टू सिचुएशंस इनकरेक्टली. सो जब वो एक बार हिम्मत करके कर भी देते हैं, मैजिकली दे सी द चेंज इन द चाइल्ड. So something as small as stopping a bottle feeding, stopping the screen time, इतने से भी वो घर पे शुरू कर सकते हैं. Not worry about therapy also initially. Once they do that, they will notice that okay, this child is not moody, but the child is not able to connect with me calling out to the child's name, or जब सब खाना खाने बैठे हैं, the child is not able to sit with the family and connect
Eat.
with that activity as a group activity. So that is a good starting point.
Got it.
It should not, that process should not take too long.
Okay.
So we quite often have to counsel a parent that these are certain home interventions. You start applying them at home. Monitor the child for 3 months. I will also follow up the child for 3 months. And by that time, the parent would be more aware, more accepting, and then therapy becomes more effective also. The challenge is if the wait and watch happens for like a very long time, so they are just lost to follow up. ये बाबा जी को दिखा के आए, ये डॉक्टर को मिल के आए, ये होम्योपैथिक ट्रीटमेंट स्टार्ट करके देखा, इन्होंने तो हमें गारंटी दे दी थी कि सब ठीक हो जाएगा, बच्चा बोलने लगेगा. And by that time 6 to 12 months have gone in the whole process, and then they are sometimes afraid to come back also, thinking कि हम डांट लगाएंगे. And that happens sometimes कि we also feel frustrated. I had told this to you 1 year ago, why did you lose out on this time? But it is all well meaning. We are not trying to put a parent down. If the parents start intervention in time, we can definitely minimize the effects of any developmental delay. I'm not saying कि हम उसको 100% ठीक कर देंगे, ऐसी कोई guarantee किसी ने नहीं देनी चाहिए. If somebody tells you that I'll make you 100% all right, that person is a fraud. Nobody except God, if that entity also exists, can guarantee anything. Okay, so not for guarantees, but definitely for a better outcome or to minimize the challenges, early intervention is the only way to go. Whatever is that intervention that you take, but
Okay.
it has to be with a proper follow up. इट कैनॉट बी कि हाँ सालों साल वो ये दवाई कर रहा है और कुछ असर नहीं आया, एंड देन टाइम हैज पास्ड बाय एंड नाउ वी कांट डू एनीथिंग अबाउट इट. So classically the developmental milestones are laid out such that the first 6 years the brain's development is the fastest. By the seventh year, almost 85 to 90% of our brain is already developed. The next 5% happens from 7 to 12 years, and the remaining 3 to 5% happens lifelong. So if we miss out on those first 7 years, we are missing out on a big chunk of development.
Oh
Then it
my
is only
God.
rehabilitation and taking care. It is, not complete reversal तो नहीं बोलूंगी मैं, but at least maximal reversal. That is something which, if we delay the process, it is the most frustrating time as a consultant, when I'm sitting in the office
That
and a person who I have seen 2 years ago walks in saying कि नहीं मैडम, घर वाले मना कर रहे थे, थेरेपी नहीं करवाना था, उन्होंने गारंटी
oh,
दिया ये वो.
I can.
And then I can see this child is having major behavioral issues, which itself is like going down back into the hole and now bringing the child back up. It is very challenging, and it's the most frustrating thing for our
I
therapy team also
can
sometimes.
literally relate. I can literally relate the frustration, I'll tell you. I have been to colleges right now, and I'm saying that, this is a must.
Yes,
Mental fitness. At
absolutely
least they should know that what are the quality of their thoughts.
true,
Is
true,
there a way they can change?
true.
Why practicing gratitude? Why practicing breathing? What it can do?
Yes,
या आई नो इट इज मैंडेटरी. गवर्नमेंट ने भी बोला है, साइकोलॉजिस्ट है हर कॉलेजेस में एंड ऑल. कितने बच्चे आ रहे हैं साइकोलॉजिस्ट के पास? कितने बच्चे आ रहे हैं काम? उनको आइडिया ही नहीं है.
आइडिया ही नहीं है.
एंड देन
एग्जैक्टली.
I mean, people are not taking the initiative that this is a global problem which is
Absolutely.
just increasing just because it is not a part of education. Before I got to know that, moral science used to be there in our education system in convent. Recently, who we had a talk with, convent related. There was this guy yesterday, we
Yeah.
went for the corporates also. Right now, there are so many subjects, there's so much competition. Moral science subject is only removed.
That is an optional thing.
It is removed, and this is like behavior,
Absolutely.
the kind of things you will help you in growing has been removed. And then they say
And
mental health is
moral
increasing.
science classes in school have gone. Story reading at bedtime has gone. So and grandparents telling stories to the grandchildren has gone, and all the stories that the child is listening to as a child
Yeah.
is Cocomelon or Peppa Pig. What moral
Oh
skills is the
God.
child going
Oh
to develop
yes.
from that? So
True,
that
true,
is a
true.
big challenge. Or you have this Doraemon and Shin-chan. Shin-chan is probably anti-moral stories. So yes,
Yeah.
it is
A
a big
very
challenge.
big
Yes.
challenge.
So like about mental health in colleges, we, as a part of Adolescent Health Academy and Surat Pediatric Association and Parenting for Peace, we have been doing a lot of these YOLO sessions, you only live once sessions, where we go out to the colleges and we do an awareness talk, where through videos which uh, some members of our team only have prepared, along with identifying what are the red flags, or not just red flags in yourselves but in your friends also, like for suicide prevention. So the idea was to make children who are in that very vulnerable age, just out of school, in college, with a sudden exposure to too many things and a lot of other challenges also. So we do these every year, and still every year we still get news that this so and so student in this college or this campus died by suicide. And I was discussing it with one of my colleagues, that what's the point of doing these sessions if we are still losing these children. And he said that, Swati, maybe we are we may not be able to save all, but maybe this could have been
Contribute.
3 or 4 children, and we are
We
able to
saved
save the
you.
other two.
Yeah.
And it's a very what do you say, a backhanded way of feeling okay
Better.
about it. But it is very sad that mental health is something like, there is very poor social emotional regulation from very young children.
Very young, yeah, very young. Even
So a
from
child who throws a tantrum, the parent will give in to the demand. That is the point that the resilience starts to go down. The child does not know how to accept rejection or hear or no. And this magnifies when they grow up, exam failures, relationships, everything, just snowballs from there. And then they are not able to process the whole situation, or to be able to,
and then they go to in
exactly, then
depression or
they go
something.
into depression or substance abuse, multiple situations, and it's just like down deeper into the hole.
So
So
true.
if the child or the student was aware that, okay, I am struggling with this emotion right now, I just need to talk with somebody, and that somebody also needs to just guide them or direct them to some support group or some counselor who can help the person out. So recently we did a lot of peer training in the police groups. So with the police supporting this mental health initiative, uh, we have done peer training of psychology students, police cadets, as well as certain social volunteers who are running some mental health support groups. So giving them the basic know-how of identifying or how to tackle a crisis situation for not just suicide prevention, but running the helpline. And these posters have been put up at most of the colleges or schools also. So there, I just came from Narmad Library, and there is this huge poster on the outside. And this should happen at every public place. So whether it's the railway station, the airport, the bus depot, every school and college, right where children can read that if you need help, call this helpline. Don't wait for things to snowball or become worse to a point where you need medical treatment. These are, a lot of these conditions are preventable, but just that stigma that if you go to a psychologist,
You are something
you
is
are
wrong with
labeled,
you. Yeah.
has to go, has
This
to
has
go.
to go. True,
Yeah,
true, true. Now I guess little bit awareness is
has
increased.
improved, yes.
Yeah, yeah.
But then
And
the counterpart is that people have stopped taking care of themselves altogether. They call themselves depressed already. So I had this 4 year old's parent telling me कि madam मेरा बेटा depressed है. And I had to put a break on that. So
ये word इतना
do not,
easy नहीं है कि ये तुम
don't
use.
label
Yeah.
people or yourselves, that I have anxiety. It's not fashionable. Okay, anxiety, being anxious, or you should talk about your mental health issues. So when Jemima Rodriguez spoke about it on national television, it was a very brave act. That is to just help people open up about it. It is not something to show off or say that unless I have anxiety or unless I have depression, I'm not cool with the crowd. That is not how it should go. That's the other extreme that we see sometimes.
Oh, yeah.
So it is not an escape mechanism.
Yeah, true, true, true.
So balancing it out, having the right awareness, reaching the right people, seeking out the right support is what you need. Don't go into self-diagnosis for sure.
We deeply explore what it really takes to support children, not only medically but also humanly. And it is so insightful that the entire conversation is divided into two parts. The second part completely focuses on autism. 1 out of 40 children are autistic children, and if they are not treated in their early age, it can be disastrous not only for the children but for the entire family, which is not curable. And if at all it is taken care in the early age, how this can be miraculous for the family as well as for the child.